Hello, 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 everyone. Welcome to another episode of Sree's Daily Global Show. This is our daily conversation with newsmakers around the world. We use this opportunity to talk about the various crises facing the world: the healthcare crisis, the medical crisis, the financial and economic crisis, and the crisis around racial equality. We present this in cooperation and partnership with Scroll.in, one of India's leading news analysis and information websites. Please check out Scroll.in and follow them at Scroll_in on Twitter. I'm coming to you live from New York. We are here on episode number 113. That means we have been on lockdown in New York for 113 days in a row. And we've been live 113 days in a row, including weekends, because we want to bring to you as much vital, accurate information as possible. Today, we're going back to world headquarters of the World Health Organization in Geneva. We'll be learning how the WHO learns, teaches, and trains across its immense network. This is episode 113, as we said. In episode 99, we met the WHO chief scientist and the director of pandemics. And you will be able to find that in our archive on youtube.com/Sreenet, youtube.com/Sreenet. In a few minutes, you will be able to say hello to our four fabulous guests. We'll be joined by Dr. Gaya Gamhewage, Christine Tretter, Zara Al-Amin, and Dr. Friday Idoko. And they will talk to us about how the teaching happens, how the learning happens across the network. Please stand by to meet them. What you can do right now is to hit share so that your friends and family and colleagues around the world can join us. We're live right now on Facebook, on Twitter, on YouTube, and on LinkedIn. My name is Sree Sreenivasan, and I'm the Marshall Loeb Visiting Professor of Digital Innovation at Stony Brook School of Journalism. And it is my honor to be with all of you today. And we're so grateful that you can be with us. Please hit share. You know someone somewhere in the world who would benefit from this conversation. So please share this so that they can benefit as well. We have a great lineup of folks who are going to help you understand what's going on. I want to start by thanking our sponsors who make all of this possible. And our sponsor first, Rutgers Global Entrepreneurship Experience, a virtual teen camp. Learn from top entrepreneurs at Google, Facebook, Cognizant, Angie's List, and get 20% off with the code SREE. SREE, please check that out and go to globalentrepreneurshipexperience.org. We also want to thank our friends at Muckrack Academy who made it possible for me to host a free Fundamentals of Social Media course for journalists, PR pros, and everyone. It's a free certification that you can get by going to mrac.co/social right now, mrac.co/social. And it's about 2 hours worth of content that you can do in 2 hours or 2 months. Take your time and get a certification. People are posting their certificates online. This is Lauren Mack's certificate, and you can have one too, and a line on your resume. It's mrac.co/social. So with that, we are now ready to bring onto the screen our very special guests who are going to talk about how the WHO learns and trains and teaches. And you can ask questions. So please post in the comments where you are watching from. We want to hear from you. Our guests are Dr. Gaya Gamhewage, Christine Tretter, Zara Al-Amin, and Friday Idoko, Dr. Friday Idoko. I'm going to bring them all one at a time on screen so that they can say hello to you. First, we'll start with Dr. Gaya. Hello.
Hello, Sree. Hello, everybody.
How are you doing? The first question I always ask is, how are you doing? How's your family through all of this?
I'm very well. My family is across the world, but all safe. But our thoughts are with everybody across the world who's battling this pandemic. Thank you so much for having me and my colleagues on your show.
Thank you for being here. Let's bring on Christine. Hi, Christine.
Hi, thank you so much for having us.
Tell us how you are and your family.
I'm doing well as can be. We're all working remotely. My family is spread out across the world as well, and like everybody else, we have our concerns and and that they're safe and well.
Thank you. Let's go to Zara. Hi.
Hello. Hi, Sree. So happy to be here. Everything's fine on my side. I'm also teleworking still from Geneva, and I'm fine. And I hope everyone is safe as well.
Thank you. And let's bring on one more guest, Dr. Friday Doko. Hi, doctor. Oops, 1 second. We'll just unmute. Can you just unmute your mic and we'll... Hi, how are you doing, Friday?
Yeah, I'm doing good. Thank you. Thanks for having me.
Great to have you here. And the same question to you. How are you doing?
I'm doing good. My family is also doing well. It's been a difficult time of this pandemic, but we're all fine, and I'm grateful for that. Thank you.
All right, very good. So I'm going to just ask our two interns, so just so everybody understands what's happening here, Dr. Gaya and Christine are going to talk about the work that is done by WHO for teaching, training, and learning. And we're going to spend a few minutes with them first, and then we're going to bring back these two folks who are interns in the big WHO program and give us their experience as well. So we're going to ask them to step off for a few minutes, and we're going to bring them back. Okay, so we'll just bring you folks back in just a minute. Thank you. In just a few minutes. So let's start with Dr. Gaya. If you can tell us about your work and why it's important more than ever right now.
Sree, I'm very fortunate to head all the learning, training, capacity building for WHO's Health Emergencies program. And this program was reconstituted after the Ebola outbreak of West Africa. And we really learned a lesson there that we must prioritize training and learning, not just before an emergency, but also during. So since this particular pandemic has been experienced by us since early January, what we've done is we've scaled up our training. And because of travel bans and because of safety issues, we're doing most of our training online. And just in the last 5 months, we've been able to reach nearly 4 million users on our platform for 13 COVID courses. But this is just one aspect of learning. Even during the lockdown, we still had to support people in countries. As you know, health situation is very different across the world, and some countries need more support. But in a pandemic, which is usually caused by a new virus, we realized that everybody needs to learn. We need to learn, and we need to help frontline responders respond. So my day job is training. My emergency job is training. I'm actually in the office. I'm one of the few people in the Geneva headquarters today. And we've been doing this for a very long time, but I think everybody's understanding the importance of real-time learning during a crisis like this. Because if we know what to do, if we have the knowledge and the skills, we definitely can reduce the number of lives that we will lose, the number of people who become sick. And it really has become mainstream in the organization's response.
Thank you, Doctor. We have Christine with us, who is part of the internship program. Talk about your work, please, Christine, and then we have questions for both of you.
Okay, so I'm managing the day-to-day operations of the internship program, and it's actually a really exciting and historical time for the program because for the past year and a half, we've been implementing a series of reform and changes to the program to bring it to where we are at today. In May 2018, member states voted on a resolution to reform the program, which included the target of bringing, by 2022, 50% of participants in the program from low and middle income countries. And in order to make the program accessible, we implemented a lot of changes, provided a lot of in-kind assistance, and started to prepare to roll out the financial assistance for interns. So the interns that are currently here in Geneva, it's actually the first cohort that not only have ever gone through a pandemic like this and this unique experience, But they're also the first group of interns to have received the living allowance, because we rolled it out in January 2020. So at the time, we had 32 interns that had arrived between January and March. And then when the pandemic, when we went through the lockdown, there was the option for some interns to return home, or the contracts ended and some stayed. So now we have about 20 interns that have stayed on and continued through the lockdown period. And today we have 2 with us that have been working intensely on the COVID response. So very unique time and very unique experience for them.
Thank you. Just to understand that you have all kinds of people being trained, right? You have medical staff as well as non-medical folks, and also researchers. Can you give me a sense of that range of training?
Yeah, absolutely. So in normal times, we focus on public health responders, epidemiologists, people who go into communities to investigate a disease, who do contact tracing, who know how to use the latest laboratory tests to confirm diagnosis. And then, of course, there's a whole range of training for people who take care of sick people. So the clinical management of people with illness, including COVID now, infection prevention control. So there's a whole range of trainings for medical and paramedical staff. There's trainings for other people who can set up urgently the facilities that are required in a safe way. And also there's a great deal of training for logisticians, for epidemiologists, for people who are doing contact tracing, but also for decision makers, because this we've understood is a very, very key issue. So although our mandate is broadly public health, during emergencies, we do a lot of support and training, and through partners based on our guidelines for clinical practice, so that people who are sick get the best care possible. And this is not just in pandemics, in whatever the epidemic. So for example, in Ebola, where the basic health services didn't exist, it was WHO who helped do the training with very important partners who gave healthcare to people, and in fact saved many, many thousands of lives.
And that's so important at this moment. If we can just ask you, Dr. Gaya, to put into perspective why this all matters. In America right now, you know that we're having a crisis out of proportion with anywhere else in the world almost. And we're not even past the first wave. And there's at some points, but depending on how you measure it, that first wave, it bent a little bit, but now we're higher than we were in April and May. So the people who think this is a hoax, this is not important, talk to them, please, because we have so many people watching now who can share this with their friends and family. In America, this has become a political statement, whether you wear a mask or not, and things are just unbelievable. I don't think there are many countries in the world where that is the situation.
Yeah. I think, Sree, the first thing is to say that the situation in each country is unique, and it's very, very difficult to comment on a situation in a country. But the things we can say are clear. What is clear in terms of science and public health? The thing that is clear is that we have to do several things together, not just wear masks, not just keep physical distance, not just do testing, not just give healthcare, not just isolation, quarantine, lockdown. We have to do all of this in its entirety for it to have an impact. For anybody who thinks this pandemic is not serious, I have to really urge you, the pandemic is accelerating. In the last week, we've had 160,000 cases reported a day. Of course, in some parts of the world, including where I am, the numbers have gone down, but there's no guarantee they will stay down. The thing with the pandemic is the virus is new. We don't know what it will do. It's a very clever virus. You can carry it without having symptoms. So I think the best thing to do is to be humble, listen to those who have the limited knowledge, and take the advice. Take the advice for yourself, but take the advice for everybody around you. So one of the reasons where I was very stringent in my own personal life is because I have my elderly mother living with me, and I took precautions for her. And I think this is how we should approach this, that this is for me, for you, for my family, but it's also for the world. The World Health Organization Director General has said time and time again, we need solidarity amongst nations, between tribes, between families. So I can't emphasize this enough. This is the moment to take public health advice.
And let's look at this tweet from @Dr. Tedros. tell me what he's trying to say here and why it's important.
So absolutely, it's what he's much more eloquent than I am, and what he's saying is that one action is not enough. It really is not enough. We need to wear the masks where masks are indicated. We have to test according to the strategy in your country. We have to do physical distancing, not social distancing. We must physically distance. We must do very robust contact tracing. And another issue that everybody knows about, people who are sick must get the health care they need. And we know inequity in all of our societies, from the richest to the poorest country. We are seeing existing inequity problems arising now. So this is not the virus. The virus is bringing to the surface things that were challenges already in our society. So really, as I said before, it needs to be done as a package. It really is like having a meal. You can't just have one ingredient to make this recipe. We have to do all of it in its entirety, and enough people have to do it for there to be an impact, and for this pandemic, for us to ride out this pandemic as safe and as healthy as we can.
So thank you. Christine, let me ask you, in terms of how you are working on this from the learning aspect of it, the interns, how many interns are we talking about? Where are they from? We're going to meet two of them in a few minutes, but talk about that, please.
Okay, so when we started, when we reached March, we had 32 interns that had arrived. We had more that were supposed to arrive, but because of the restrictions on border closures, we had to put a suspension on the program. So of the 32 that were here in March, some ended their contracts, some went home, and 20 stayed. So we have, for the two that will be on the line a little bit later, one is from Lebanon and one is from Nigeria. We have people from Bangladesh, from USA, from Canada, Mexico, Saudi Arabia. It's really quite a mix. We have actually, I had written this down earlier just to double check, and we had 25 countries that were represented in the original interns that were planned so far for the year. So, and right now we still have about 18 that are still here with us in Geneva. It's quite a range. It's very diverse, and this really helps the programming because people bring their own country perspectives. It's very interesting in terms of capacity building, because what's being learned here with this opportunity for the interns to not only be exposed to the response and what that entails, but to also have a chance to support it and contribute to it, then build that capacity and bring that to their home countries when they return. I have to stress that there are some interns that are working full-time on the COVID response, but generally everybody across WHO in some way is supporting this response, because everybody's working in a different capacity now. Everybody's working mostly remotely. They've shifted hats, they've shifted their terms of reference a little bit. So everybody is helping in some way. And there are some interns that have been doing a little bit here and there on COVID specifically, some that have been completely 100%, and others that are supporting by picking up other work that had to be shifted around. So this is a fantastic experience for them. It's a difficult experience, but this group has really shown what they're made of. They've been fantastic in adapting and just sort of rolling up their sleeves and getting in there and making the most of this experience.
Thank you. Before I bring on our other two guests, bring them back, we just want to do what we call a global tour to see who's watching, and we can react if you have to any of their comments or also any of their places, because I know you all travel a lot. So if you've been to any of these places or have any comments, our first guest is always Jonathan Borstein, who watches from Union Square. He's watched 113 straight episodes, and he's always wearing his mask when he comes in. So I know, Doctor, you've certainly been to New York a lot. So any memories of New York that what would you, if you could come to New York tomorrow, what are the first things you would want to do? I've traveled to many countries, but I remember traveling for the first time to New York with my children, and my children are very, sophisticated. They've traveled everywhere, but their jaws dropped when they were in Times Square. And I think the images of New York and many of the large cities around the world, abandoned, empty,
really will stay in our hearts, I think, for this entire generation, because we see the power of a virus. But if I'm in New York, my favorite thing is to watch a musical. I really like the theater district, so I really love New York. So hello, Jonathan from from
One of the sad things, as you've noted, is how life in New York has been affected. They have postponed Broadway reopening first to September and now till at least January, and that tells you how serious this is, because as you know, the city depends on that income from tourists and others going to those shows. So let's keep going. Carape is watching from Bahrain. And by the way, Christine, if you have any interns from any of these places or you work with any of these folks, let's just use that as an opportunity to talk. Radyan is watching from Long Island. Ashish is watching in India. What do we do in India for training and things like that in terms of WHO and training?
So first of all, India is a strong country, and that's where we've located our regional office for Southeast Asia. And for the online training for COVID, it's very interesting. India is a very big user, and we have about, I think, 80,000 users at the moment from India, 80, 90,000. It grows every day. And we have courses on COVID in Hindi, in Urdu, in several local languages as well. But the most significant thing is we have a COVID course in Indian Sign Language. And Sree, what you have to understand is people in India are not just receiving our courses, they're working with us to translate and adapt to use in their country. On top, this is just the digital training, but of course our country office and our regional office are doing a lot of work there. WHO's role is really to work with ministries and help them deal with the basic outbreak response, how to identify, how to diagnose, how to treat cases. So we are constantly working with them. We have people in 155 country offices around the world, and they are the first to work with countries. But India has been a champion of online learning for COVID. And I'm really, really happy to say hello to anybody from India. I myself am from a neighboring country, so I'm particularly happy.
And that's Sri Lanka. We should be
That's
clear.
Sri Lanka.
And Sarah is watching from Seattle.
Absolutely, on the West Coast. Yes, I have family on the West Coast, and a lot of our very important donors are also on the West Coast. And we have to acknowledge WHO is made up of all the governments of the world, of the ministries of health, but also we have many strong partners, if you take foundations and others, who've been with us throughout time. And this is over 73 years. The major public health achievements, the eradication of smallpox, took everybody, partners, community, so vaccination, the gains we've had in that. So absolutely, Seattle is a source of inspiration for us.
Great. And Ron is watching from Dubai. Ron is a regular viewer. And what is the situation in the Middle East? We'll actually have a guest shortly from Lebanon.
So I think that for COVID, what WHO is saying is don't let down your guard. Things can look better in certain cities and within countries, in the US as well. There's a big difference between states, but this is still very much dynamic. So don't let down your guard, stay vigilant, stay safe, and build on the gains that you've already made. That's
great advice. Ashok is watching from Kerala. Jeshran is watching from the Philippines. Paula is watching from Florida. Here's a question Jeshran is asking. Has remdesivir been approved by WHO?
I have to be very honest with you. I am not a technical expert on the drug treatment. So the best lesson in WHO is don't answer questions that you don't know the answer to. But I do know there are lots of studies going on about it. So I will wait to find that out myself.
And I will say to us, even when we're dealing with WHO, we're not giving medical advice here. No one's giving medical advice, health advice. Make sure you follow your country guidelines and your personal physician. We've had more than 40 doctors on the show, and we always say that because we don't want people taking as medical advice what we're giving out here. Kathleen, who's watching from Kansas, says, thanks for being here, improving our knowledge and hope for progress. And Radyan is tagging people. Everybody, please do that. Tag your friends and family so they can watch this even afterwards. They don't have to watch it live. And Rose is here. Rose is one of our two producers, Rose Horowitz 31 on Twitter and at Vandana_Menon on Twitter. Please follow them. They're doing great work. Stefan's watching from New Jersey, and he says, thank you to all the WHO folks who do so much for our global well-being. And Marilyn is having lunch on Staten Island. And Dilip is watching from India. Here's a comment from Ashok. We in Kerala have containment zones where there are positive cases, and we try to publish the route map of all these positive cases. But now cases where we got infected are on the increase. So we're on the brink of community spread. This is his feeling and every country, every neighborhood is going to be different. Correct, Doctor?
Absolutely. So it's very difficult to generalize. And that's why WHO has issued guidance on how to characterize where where COVID is in that community, whether it's isolated cases, whether you have community spread. And that guidance is very clear. So I think we should stick to the science. I don't think we should predict. I don't think we need to guess. We need to follow the advice that is clear. And we need to stay vigilant. And this is very difficult as we get into the 5th and 6th month of a pandemic. People were quite vigilant at the beginning, but we have to maintain vigilance because this is not over yet.
And we have somebody watching also from Europe in Vienna. Margaret's watching. And as you know, it's another big UN town, right? Geneva is a big UN town. And Vienna is also where the Atomic Energy Agency and other agencies are there as well. And Vandana has put in a link to the online training courses. So maybe I can ask Christine this question. These online training, is that available to everybody or only certain kinds of folks? What is the story?
Well, actually, for the online training, this is more Gaya's area because she's leading that. So I'll pass that on to her. But our interns definitely have access to this internally.
So Sree, this is the open WHO platform that is free. It's freely accessible and it's accessed by every country on the planet. It's absolutely free. We use low bandwidth and offline versions, and you can use it on your mobile phone, on your iPad or your computer. So we really try to think of accessibility. But the most significant thing we've done, because I've worked in emergencies for more than 2 decades, and what we understand is at the front line, when people are under pressure, they really appreciate and can use material in their own native languages. So what we've done is we've translated the COVID courses so far into 33 languages, and all of them national, local, dialects. The whole point is that people should get the information without any barriers of language, barriers of digital divide, and barriers of technology. This is the way to fight this pandemic, but it's also the way to prepare the world for the future health challenges that we still have. There are many, many health challenges that we continue to face and will face as new challenges.
And that's certainly what we know is going to be an issue. This is not a one-time thing. I think a lot of people think that this is going away. As you know, we had the chief scientist of WHO, Dr. Soumya Swaminathan, and the director of pandemics, Dr. Sylvie Bryan, with us. And they kept saying that this is not a one-time event. We've got to be very, very aware of what is happening. Ashok was asking, can common people like him attend the online training?
Absolutely, Ashok. I don't think you're common, but yes, absolutely, you can attend it. It is open. And
Yes.
actually, Sree, I have an interesting fact. So we have a lot of public, not health professionals, people, everyday people, students, people come onto these courses. But in this pandemic, we have noticed that people over 70 are also coming to the courses. And I think this is because we noticed that older people were at risk, and older people are coming to our learning platform to learn about the disease. It's an incredible movement where people really want the knowledge that they need to save their lives and protect loved ones. So I really feel, there's a great opportunity. And WHO also is, the Director General of WHO already proposed a WHO Academy going forward, where we would consolidate, strengthen, and further expand. And these are some of the ideas that we are putting into the strategy for the Academy, so that people, for individual health, for the health of your community, for the health of your country, or the health of the world, can come and access the knowledge and the skills they need. So I think there's great opportunity, although this is a very, very tragic and challenging time.
Thank you. Christine, I'm about to bring on our two interns, so you can just give us a little briefing on them, and then we'll bring them on. We'll pretend they're not listening backstage.
Okay, so I'll just tell you a little bit about each. So Friday Idoko, he's from Nigeria. He has been with us since February, and has been working from home, home in Geneva, throughout the lockdown. Both interns have, actually. He's been doing work on more of the quantitative side of the COVID response, and I'll leave it to him to answer more questions about that. And then our other intern is Zara, and Zara is from Lebanon and has been working more on the qualitative side, so research and qualitative information and sharing across different levels within the organization. So I think that you'll have an interesting perspective of what their experience has been. Both have been here since the beginning of the year, January, February. So it'd be interesting to ask them some questions about what it's been like.
And of course, it's a very easy program to get into. Your standards are very low on who gets these internships, correct?
Well, actually, so we've revamped the program. We've reformed it completely. We've made it very accessible in terms of people worldwide now can go to the website and actually apply for individual internship positions that are posted. So every internship position that will happen now in 2020 is posted on the public website, and people can apply. There's an opening period, and then it's on for a few weeks, and then it closes. So it's a competition, it's a competitive process. And this is different than what existed before. This is part of the reform of the program. Before, it was a little bit of, how do you get into W.H.O, and maybe there were certain channels or people you knew. And now it's completely transparent, and there's a position, each position is advertised. So in that sense, it's more accessible, yes. I wouldn't say it's easy to get into. There is definitely, it's very competitive, a lot of fantastic profiles from people around the world, and this is exactly what we wanted. And the member states wanted, the whole world wanted to be able to have the opportunity for people coming from anywhere, any country, to have access to an internship, not just that maybe they went to a certain university who had a connection, but that you can log on wherever you are in the world and you can apply and have a fair chance to undertake and be chosen for an internship.
Terrific. What is the next round of deadlines, or are you pausing the program while the pandemic's going on? How can people sign up?
Yeah, at the moment it's still paused. So we paused it from March 16th, and then initially that was until the 30th of April. But as the situation has evolved, we've continued to keep that on pause because we're watching very closely what the situation is. And we're also helping the interns as certain borders open up and flight becomes available again. We're looking into how and if we can help the interns that have been here to make it home safely. So at the moment, the program is still paused, and when this changes, the information will be provided on the website.
Perfect. And I'm about to bring them on. I'd love it also if, I know the four of you probably don't get a lot of time to just kind of chat. It'd be interesting later. I'll give you a moment to ask them and them to ask you a question also. I think that'll be fun. Let's bring on Friday. Hello. Great to see you.
Hello. Yeah,
and here is Zara.
Hello.
Okay, so first let me ask Friday, you've been listening to us for about half an hour. Any thoughts on what you heard so far? And then tell us about the program and its value to you.
Okay, thank you so much for having me on your program. Like it's been mentioned already, I'm Friday from Nigeria. I am I feel very lucky and privileged to be part of the internship program of the World Health Organization, and also supporting to be part of the work that is being done in the response of COVID-19 pandemic. It's a really great honor, a life transforming experience, I would say. I've learned a lot. My supervisors and the team were really very supportive. While I learned, I also am happy that I was able to contribute to support the program. So what I do essentially under guidance of my supervisors, basically, so the first part of my internship, I was Then later, there was this transition from data management to supporting more analytical products and contents. And it's been a very great experience. I've learned a lot. The opportunity to be at a place where it's happening, responding, supporting the response. It's been really, really great. And this is something that it's priceless. And I hope that when I go back to my country, Nigeria, or any other place I go, that I'll be able to support, to use the skills I've learned from this program to actually strengthen the health system in my country, Nigeria, especially public health, the public health system in the country.
Thank you. I just want to say that we have a tweet from Becky Idoko watching in Nigeria. A relative, perhaps?
Yeah, that's my sister.
Okay. Well, hello, sis. Great to have you here. And I hope both our interns also had a chance to share on Facebook with their friends and family so they can all join us. Let's go to Zara. Your thoughts after what you just heard and also Friday's comments.
Hi, everyone. So I actually came here in January, and I was working on more on surveillance for influenza, and my tasks have completely shifted and repurposed for the COVID response. Particularly now I'm working with the emergencies unit and assisting in the supporting the COVID response in fragile and conflict affected settings. So for example, the main task was I supported in developing the guidance on the public health and social measures for COVID in low resource and humanitarian settings, which are based on the 8 pillars. And now currently we're working on maintaining essential health services in fragile and conflict affected settings. I also support the team in providing material which are crucial for their intervention in particularly in the Sahel region and in Latin America. I think this has been a unique and a great learning experience. I mean, okay, despite we've been working remotely, but we've learned a lot, and I think this has given me strength, and it will improve my career path. I've even learned new skills, and my skills are more refined right now. And I think we kept, I mean, as interns, we kept supporting each other, even remotely. So yeah, it has been great, and I'm grateful for that.
Thank you. Let's ask Christine to just tell us about the work of these interns and others. Why is it really relevant at this time? Why should the rest of the world care how these two and their colleagues do?
Well, why the rest of the world should care is because this is the next generation. This is the future of public health right here. And having lived through this experience, coming to Geneva expecting one internship in terms of reference for that, and switching and going through this, I think this is going to shape the way they deliver public health in the future, the way that they approach it, because not only were they going through the lockdown and going through, just remind that this is not their home country. So it's very different to be quarantining in your own country with maybe family or friends around and it's familiar, but to be quarantining in another country while you're also working on a response, and it's a high level response, that takes a lot of skill. And so I think that this cohort of interns has really developed or seen strengths that maybe they didn't know that they had. And I think they're going to take that forward into how they approach public health when they go back to their home countries, they go forward in their careers. I think this will have shaped them personally and professionally. And that's what we want in medical services and public health services. We want that compassion. We want that comprehensive approach. We want people who are thinking outside the box. And I think that this has been an opportunity for them to develop exposure to that and those those skills, and maybe they can speak a little bit individually themselves about what they've maybe picked up through the experience.
Okay, let's go to Friday first.
Okay. So basically, the experience, like I said earlier, is it's really priceless. One key thing that stands out for me is to be part of a team and supporting a team where each sub team is working on different components of the response, and then in the end, it all fits into a global picture. That diversity, that multidisciplinary atmosphere, getting to learn from experts from all over the world. This is like something that really stands out for me, especially during the morning meetings, getting a very global perspective about epidemiological events from all over the world. So it's a priceless experience for me. I've developed my analytical skills, learned some new softwares, mastered some, and also my research skills as well. Because part of what I do or support is, for instance, to answer some research question. If there are some research questions and the team is working on that, I participate in supporting those programs, and also deep dives, like what's happening in a particular country. If there is a need to know the situation in a particular context, I also participate and support with those. So it's been a very great experience building my research skills, also learning more about epidemiology. It's I feel so lucky. I think it's the first pandemic in my lifetime, and I'm happy I was part of. I was able to support the response, and I'm really grateful for the platform, the internship platform from the World Health Organization. I dreamt of working with the WHO when I was very little, and yeah, so I am so thankful to have had this opportunity this time. Thank you.
Thank you. Let's go to Zara for the same question.
Yeah, right. I agree. Indeed, we're really lucky to be interning during this period. For me personally, I mean, of course, it's not like we're going to the office and being with your supervisor. We had to adapt, of course, but it went. I mean, it went well, and we're still contributing, of course, and I always attend meetings with my team. We always do, like, we attend conferences and webinars. I've learned a lot about research and more on data collection. My data collection skills improved. But for example, particularly as interns, we also supported in developing. We came up with a video, for example, for the annual WHO Walk the Talk. We were able to do that even though it was we were working remotely. We also were able to organize a lot of webinars, educational webinars from the different WHO departments, which were very important for us on academic-wise and career-wise.
Thank you. Rahadian has been very diligent about posting links to your work. This is an unforgettable journey that Zara wrote about, and so he's posted that. And he also posted to something that Friday had posted as well. So it's great to see. And let me go to Dr. Gaya. And just a reminder, we have only a few minutes left with this team. We want them out there fighting on behalf of all of us, not spending all the time with us here. So Dr. Gaya, your thoughts on what we should be looking for as we understand the value of this learning. I know that you will be very careful about commenting on any particular government and its role in WHO, but you can talk about the value of everyone understanding that WHO has a role to play in keeping us all safe through these trainings and other things.
I think WHO has a role to play beyond trainings. I think training is a very important way that we build the future and that we interact with people across the world. WHO's value was decided by all the governments that came together. And for 73 years, every single government has worked together to fight major health threats. And, and let me be very frank about it, the US government has been a great champion of WHO and a really valued partner. Every country is valued by WHO. And the value of WHO is not that we, the Secretariat, do things. Is all the countries come together and they decide on the strategy of the organization. They decide on the health programs and they look at how we are implementing that. So I think absolutely this is the time for solidarity. But really just listening to the two interns, I was inspired because I think it's internships have to be seen as part of lifelong learning. And that's the direction we're going to in WHO. I'm really happy they picked up not just technical knowledge, but what we call transversal competencies, working in teams, decision-making, being adaptable. This is the difference. You will not learn this in universities. And this, you have to continue this journey throughout your life. So our approach to training will also change, and we will support a lifelong learning approach, not just for our interns and staff, but we will also support all countries to do this should they require our help. So I think really time for solidarity, but even more time for humanity, where we have to be humble in the face of such a challenge. And we have to be very cognizant that all of the problems that were in our societies before the pandemic have risen to the surface. So this is not the time to blame anybody, but this is the time for us to work together in humanity and solidarity. And really, I'm very optimistic with interns that we've seen here today, but also people in countries, our staff. Everybody should be learning throughout their lives, and we will try to help if we can.
Thank you. And Dr. Gaya's Twitter handle is Gaya G, G-A-Y-A-G. Aman says, looking for a career in public health right now. He's a final year veterinarian student. So I'm curious, obviously, we talk a lot about animals and humans and those connections. And is there room, work for public health that intersects human and species, other species? Can you talk
Absolutely. I think we're realizing that we're not the only species on the planet. So we have a program, and it's with other organizations. It's called One Health, where we look at the human, the animal, and the environmental. So we work with the International Organization for Animal Health as well. And we come together, and there are vets who work in WHO. In fact, WHO is not just doctors. I happen to be a doctor, but I have 22 people, and none of the others are doctors. So we really need all this multidisciplinary approach. And you will see for this pandemic, most of these viruses that cause pandemics come from animals, and they jump species to humans because of the interaction we are having with them. So absolutely, there is place for vets in global public health, whether with WHO or with others, but we have to see our health and our survival in the context of a broader world.
Thank you. Ashok says he's really proud to be an Indian because you said all those nice things about how India is doing. But of course, it's time to be vigilant and not ease up on anything, correct?
Absolutely. Build on the gains we have. Don't let the sacrifice we've all made go to waste. Let's just continue our vigilance. Follow public health advice and think not just about yourself, but everybody else.
Thank you. Radian says, I'm a big advocate of lifelong learning, especially since I'm a late bloomer, and lifelong learner helps one adapt to a changing world, in my opinion. I think you're absolutely right. And he says, since many new viruses are trans-species, so the experience and skill sets of veterinarians are very important. So great to hear that. We just have a few minutes left. I want to go around the room and have each person give us kind of their final thoughts and some words for people watching around the world who know so little about the WHO itself, but hear about it all the time in the news. You're making it human for us. You're making it public and visible to us. So I'll start with Friday and then go to Zara and Christine and then Gaya. So let's start with Friday. Your thoughts as you say goodbye about your work and the value of WHO.
Okay. So I am amazed, like absolutely amazed at the work, the efforts that staff of WHO put in this response. It's the first time I'm seeing such kind of efforts from a very big team, all working harmoniously towards a common goal. Oftentimes going beyond the normal working hours. So WHO has really, this experience has really given me the opportunity to see how things work here and the importance of WHO to the world.
Thank you. And I have to ask you this question: when you go home to Nigeria, to Lagos, what is the first place you will go to eat when you go there, so that we can all get some ideas from all of you. So for each place. So we'll start with Lagos, and also give us a Geneva restaurant recommendation, please.
Oh.
Friday,
Okay.
with you.
Okay, so I will talk about Lagos. Maybe for Geneva, leave that too. Okay, so for Lagos, basically, there was if you go to Lagos, just look for anywhere jollof rice is sold. That's like a signature dish for Nigeria.
I love jollof rice. I've not eaten it in Nigeria. I've never been to Nigeria. Spent time in Africa, but not in Nigeria. So any place, that's a good recommendation. That's a broad recommendation, but we'll take it. Thank you very much, Dr. Friday Idoko. Let's go to Zara.
Yeah, I'm very thankful for WHO for this opportunity, and yeah, really, it's the first time. I mean, since the beginning of the pandemic, staff have been working tirelessly on the response, and I've learned, as I said previously, I've learned so many skills, and I've discovered a new career path, which I'm passionate about. And most importantly, I think I learned how to really become a real public health professional, and how to work in real life, and to work ethically and with respect, and of course that our work should be evidence-based. So and I wish the best for everyone, for future interns. Thank you.
All right, and Beirut restaurant recommendation.
Oh yeah. So first in Geneva, you have Bain de Paquis. It's a good restaurant. They have fondue, which is very famous here. In Beirut, you have Temar Bouta, I think, if you've heard of it. But they have really good food. Lebanese, typical Lebanese food. Yeah.
I've not been to Lebanon, but I spent a lot of time in Dubai. My kid brother lives there, and they have lots of Lebanese restaurants. Some of the most popular restaurants in Dubai are Lebanese restaurants, as you may know. So thank you very much, Zara Al-Amin, for being with us. Let's go to Christine.
Okay, so I'll say that if you're a student and you're interested in WHO, by all means, please check out the website and look into the possibility of applying for an internship. There are positions that are posted. At the moment, they're paused, but when they do go back up, they'll be posted, and they're constantly changing. So you can, there's no deadline for a specific cohort. You just keep checking, especially if you're coming from a low and middle income country. We need you, so please apply. And what I want to say is that working with interns is fantastic. Working with this younger generation is fantastic. And I think we're seeing the way that everybody is driving change. And in this pandemic, every single person, regardless of your age, is important. Everybody contributes in some way, whether it's by wearing a mask, whether it's by checking in on your neighbor, whether it's by washing your hands, whether it's by showing compassion. Everybody contributes, and we need to make sure that we don't get complacent and forget about that, and forget that there is actually a very real danger out there with the pandemic. And I think that this generation is showing everybody right now how to stand up and be counted. And I think that we need to all remember that what we bring to the table is ourselves, and that everybody has a valuable contribution. So this is something I'm very proud of what I've seen in the interns in the past year and a half, and particularly with this group that's adapted so well. So first I want to thank them, these two, and as well as the larger group of interns that we have here at WHO.
And where should they go on the website? We mentioned the website many times, so tell us where to go.
So you'll go to the employment section. So if you scroll down all the way to the bottom, so WHO employment on the left-hand side is second, yes. And then you'll go to, I can't really see because it's small, but it says WHO internship program. It's the third button.
I see it. Yeah.
And that's, we have our own page, and you'll see internship positions for various offices around the world. So it's not.
And you also have a newsletter. You have a weekly newsletter, so people should subscribe to that for sure.
Yes.
I think that would be very good. So everyone knows now how to find it. So we hope they do that. And Geneva recommendation.
It's been so long since I've been to a restaurant now.
Yeah, exactly. So where do you plan to go when you can go out?
You know, there's a little place down the street that I love that it has Portuguese food, and they have piri-piri chicken, which is kind of Portuguese, South African. And I miss sitting in that restaurant, the atmosphere. So it's called Zidi Popo or something like this it's called. But it's very charming and very nice food. So.
And do you have a sense of where Geneva is? I mean, I'm sure you do. Like, where are you in the opening phases? Are they more indoor dining has started yet or not yet?
Well, they've lifted restrictions in Geneva. The canton has lifted some of the previous restrictions. We're out of lockdown, but we're being vigilant. The canton has issued formal guidelines on their own webpage where they've increased the number of people that can be in a gathering. However, and restaurants are open, but everybody needs to remain vigilant, and it's a personal responsibility to do that. So. That's where
I trust that the Swiss are much better at listening than Americans, so we won't have you comment on that. But that's my editorial. Let's go to Dr. Gaya. Christine Tretter, thank you so much for your time.
Thank you very much.
Let's go to Dr. Gaya.
So I think one thing we've learned is human behavior. So, we're trying to control a virus, but what we really have to understand is we are playing a part in this pandemic. Sree, your question was to tell people about WHO. The first thing I can tell people about WHO is that I'm very proud to work for WHO. I've done this for 20 years. And I do this, and I was a medical doctor. I'm doing this because public health matters. This organization was set up by countries because we wanted health for everybody. We wanted equity in health. We didn't want people to suffer because they were poor or they lived in certain countries. But over the last 7 decades, we've seen we need to collaborate for health. International cooperation is important. We can't tackle pandemics as single countries. We can't even tackle the heart disease or cancer as a single countries. We know that pathogens, bacteria, viruses, they don't respect borders. But it's not just for that. If I ask you, how do you know the air that you're breathing now is safe? How do you know the water that you're drinking is safe? How do you know that this medicine that the doctor has given you for the diagnosis she has given you is the correct one? This is all through international collaboration on science. But WHO is not just based on science. It's also based on ethics. So we develop our advice to the world based on the best science available at the time, but we also advise ethical policy decisions. Now, of course, countries, governments are responsible for the health of their people. But we really believe, and I personally believe, that global public health is more important today than ever. And if we come together, collaborate, not just scientists, but sharing our values, individual behavior change, we have made a lot of progress in the last 70 years. And we should remember, just because we're frightened because of this lockdown, the pandemic is not just hurting our health, it's hurting our economies, our societies. And just because we're frightened, we mustn't lash out at each other. We have to be human and we have to be reasonable. So at WHO, my colleagues and I, we are not shaken by praise or blame. And that's how I expect, that's how I tell my children to be. That's how I advise my colleagues to be. Let's do what we need to do, right? We can sort everything else out if we start building trust amongst each other. So, we need to take a deep breath. We're in for the long haul. It's not over. There's a lot we can do. And so don't lose sight of that. So really, all of the staff at WHO send their best regards. This has been such a wonderful experience. Actually, I didn't tell you, Christine and I worked together many years ago in the same emergencies department, and even our careers have taken different paths. There's a lot for everyone to do. Try and find out what that is and just do that. That's it. That's what we do in Emergencies. Thank you, Sree.
Thank you. You said don't get excited by blame or by credit, right? Just do your work, concentrate. I love that. Anand says, this was a very informative session. Thank you for the show. Radian says, thank you everyone for being in the show. It gives me a great deal of hope. And of course, thank you to everybody. Blessings to all of you. Rose says, inspiring to meet Dr. Gaya, Christine, and these two smart interns from Nigeria and Lebanon. Thank you for joining us. And Radian is doing your promotional work for you. Christine is putting in a link. It's in multiple languages. So this is just great to see. Everybody can be great because anybody can serve. You don't have to have a college degree to serve. You don't have to make your subject and verb agree to serve. You only need a heart full of grace, a soul generated by love. The Reverend Dr. Martin Luther King said that. Thank you, Radian, for sharing that tweet. Rashok says, thanks for the wonderful session. Congrats to all the guests for the great information, and lots more comments coming in. Jonathan, who started us off, says, wonderful show. So thank you all for making that possible. We will let you go. Thank you. Our guests have been Dr. Gaya Gamhewage, Christine Tretter, Zara Alamin, and Dr. Friday Idoko. Thank you very much. We'll see you all soon. Okay? Bye-bye.
Thank you, everybody. Thank you, Sree. Bye.
Bye-bye. Bye-bye. And thank you all for watching. We're very grateful to you. Please email me if you have any questions, sree@sree.net. And our archives are youtube.com/sreenet. And we want to tell you about an excellent spin-off show that we have from here called She's on Call. And this is a show run by two female doctors, surgeons in New York, Dr. Sujana Kurian and Dr. Sujana Chandrasekhar and Dr. Marina Kurian. And they talk to doctors and others. And we hope we'll be able to get guests from the WHO to join us in the weeks ahead. Every Sunday, 11 a.m. to noon. And this was their show last week. You can find it on Facebook. She's on Call. Everybody, please follow She's on Call. I'm honored to be an executive producer of the show, but these ladies do all the incredible work. And their show on July 12th features Dr. Quinn Capers. He'll be the first man on this show. And Dr. Susmita Pati will also be with us. And with that, we want to say thank you to everyone for being here. Thank you for your support. Please check out our archives. Please hit subscribe on YouTube. That's the way that we can continue to grow this. We're looking for speakers, guests, and sponsor ideas. So please let us know. And as always, thank you very much. One more shout out to our sponsors, the Global Entrepreneurship Experience.org, globalentrepreneurshipexperience.org, as well as our friends at Muckrack Academy, a free Fundamentals of Social Media course for everybody in the world. 4,000 people have started this. It's 2 hours of work, free certification, mrac.co/social, mrac.co/social. Thank you very much, everybody. We'll be back again every single day during this pandemic and during this lockdown. We're very honored. Sree@sree.net, please, thank you so much for being with us and for gracing us with your time. And a big shout out to our friends at W.H.O for joining us today.